Now, joining us now from our gallery studio is our political editor, Jane Patterson. Jane, the lockdown extended by 2 business days and a week roughly. Did Cabinet really have a choice here?
Well, they obviously had a range of choices, but I think they've chosen to probably split the difference. We heard public health officials, experts this morning saying that probably 2 weeks, and they also judge it, or they assess it on 2 weeks and then 4 weeks in terms of the infection of the virus. So they were the blocks that they were looking at. But look, they've extended out for a week, and that is 2 business days, as you've said, Lisa, but really often many businesses don't actually operate within traditional business days, for example, hospitality. But I imagine this will be welcome news because it means that they can actually start to prepare, so businesses can start going into their premises, getting stock ready, and actually customers can start ordering as well, so that the businesses will be able to see that business coming in. But of course, with this economic activity comes greater risk, and the Prime Minister was saying, and you've just heard her read out some of the key messages, that they really are relying on New Zealanders to still stick to those rules, because apart from a few things around the edges, really life is going to look pretty much the same for a couple of weeks under level 3 for individuals and households. The big difference is getting those people and those businesses back to work. And it's not just the ones that people might have direct contact with, so retail, hospitality, but you heard the Prime Minister there talking about construction, manufacturing. Tradespeople are going to be able to pick up tools and get back to work at people's houses or on construction sites as long as they stick to those rules. So that is going to be where the big difference has made, and obviously the government thought it was just too much of a stretch to push that out another week or further for the businesses.
Yeah, and saying that, you mentioned the modelling and other professionals have said we should have waited for 2 weeks, so why not go harder for just a little bit longer to make sure we don't have to go backwards? Did they think perhaps that the public simply doesn't have the stomach for that?
I think there would have been 2 main aspects. There would have been the economic impact, because for some of these businesses, every day, every week is crucial, and just the sooner they get back, not only for the health of the businesses themselves, but of course for the general New Zealand economy. It gets revenue coming back in, it gets things moving again, but also absolutely public attitudes. And Ms Ardern said that when they looked at people's compliance and how they sort of felt about the lockdown or saw it, they relied on Google data to see how compliant people have been, and they showed a really, really good picture. But you can only push that so far, and I think you were getting to a tipping point potentially when people were seeing that the cases were low in New Zealand, that we had a very low mortality rate compared to other countries. The question was, why are we still doing this? So people accepted the need to do it, but having seen the success, I think it would have been trying people's patience if they pushed it out too much further. And of course, that's when you get into the situation where people are actually breaking the rules. So I imagine the call was that you're better to take a staged reduction in restrictions, where people each time have a little bit more freedom, a little bit more able to do things that they want, but still sticking towards the rules. The last thing, of course, that the government would want was a public mutiny or resentment building about the lockdown restrictions. So those, I imagine, would have been the 2 elements weighed against actually the very positive public health data that the Cabinet was presented with today as well.
In terms of that data, though, the Prime Minister has clearly stated that there were 4 main planks that she was going to look at when Cabinet was making this decision. And one of them was contact tracing. And I heard you asking about this in the press conference, because the Director-General of Health clearly stated yesterday that we are not yet at the gold standard for contact tracing. So how can we come out of level 4 if even he says we're not where we need to be?
So the report from Dr. Aisha Verrill has just been released. We haven't had a chance to have a very good look at it. We do have a statement from the Health Minister, David Clark, saying that Cabinet today agreed to $55 million to boost contact tracing. That report has obviously come back, identifying weaknesses in the system, that it needs resourcing up. But I don't think Cabinet would have gone ahead with this decision if that report had been damning about the country's ability to build that resource in time. So level level 4, Dr. Bloomfield had talked about contact tracing had become easier because people's bubbles were so much smaller. They just weren't out and about and being in direct contact with other people. I imagine level 3 will be relatively the same because people's bubbles are still quite tight. It'll be level 2, level 1 from onwards that they'll really need to see that contact tracing really up to speed to that gold standard that Dr. Bloomfield talks about. That report must have given them the confidence that the government, that the country can get to that point, but they've had to put a big wodge of money, $55 million, to make that happen.
Thanks, Jane. That's our political editor, Jane Patterson.